My name is Eric Litweiler. I am the Director of Development and Communications for the Mental Health Association of South Central Kansas. MHA here in Kansas, in South Central Kansas, actually started operations in 1957, so we've been around now for 64 years. It's part of a national organization called Mental Health America. So all of our programs are dedicated either to education, prevention, or treatment of some kind of mental health issue for someone on the age spectrum, regardless of whatever else might be going on in their life. We can do everything under one roof. So it's really great opportunity and great organization. The crisis cards are a really cool new initiative that we're doing. We only launched it a few months ago. The reason for these cards is, it's got our information on the front, obviously, which is great, but the back is really what's key. And it says right at the top, if I have given you this card, I need your help. It's a lack of parity between mental health and physical health. And the analogy I always make is, if I'm at a coffee shop downtown and it's 10 degrees outside and I see a guy walking down the street with his shirt off, screaming at the birds, pretty safe bet there's some kind of a mental health issue happening there. But nobody knows what to do. Now, if I see that same guy walking down the street and he trips and breaks his arm, I know what to do. I know how to help. I know who to call. But if I see the guy with a mental health issue, I don't know what to do. I don't know who to call. I don't know where to take him. In the latter case, 99.9% of the time, if they see the guy with the shirt off yelling at the squirrels, they're going to call the police. Thing is, he's not committing a crime. He's not doing anything wrong. So these cards essentially say, if I'm having a mental health crisis, if you see me through the Starbucks window screaming at the birds, come outside, and if I hand you this card, what it's got is contact information for me. It tells you what kind of mental health issue I might be struggling with. It might say, my name is Bob Smith and I have schizophrenia. If you see, me going through a crisis, here's the name of my doctor, here's the phone number for my doctor, and here's someone that you can call. My spouse, my best friend, my roommate, whatever it might be. They know what to do. They know how to handle this, even if you as a member of the general population don't. We really want to make it ubiquitous so that people begin to realize the distinction and realize that there's a better option than calling the police just because I'm doing something that clearly isn't quote unquote normal for this situation.